Infection of lateral pharyngeal band. So, first we need to know what is this lateral pharyngeal band. So, a small introduction. What is tonsils? Tonsils are paired structures seen in the oropharynx, one on either side. These are almond shaped small structures. It forms part of the immune system of the body. So, any bacteria or virus which tries to enter through the oral cavity, these tonsils will take care. With the same function, you have one more structure which is behind the nose. This structure is called as adenoid. So, any bacteria or virus which tries to enter through the nasal cavity, this structure will take care. Now, you have one more structure with a similar function which is seen in the tongue in the posterior part of the tongue, which is called the lingual tonsil. So, these three structures are interconnected. So, adenoids, tonsils, lingual tonsil. And the connection between the adenoid and the tonsil, you have a band here which is the lateral pharyngeal band, this one, you have a structure here. So, in case the tonsils are removed along with the adenoids, what will happen is this band will get hypertrophied. So, this removal of the tonsils and adenoid, which is commonly seen in children. So, when the tonsils are removed, as you see in this picture, the lateral pharyngeal band will become prominent and that can get infected. So, this is lateral pharyngeal band and which can result in infection. The common complaint of the child or the mother will be that child has got recurrent fever and throat pain and difficulty in swallowing, and there is already a history of adenotonsillectomy. So, on examination, we find that the tonsils are not there and both the side lateral pharyngeal bands are prominent and it is congested. So, like how you see in this picture. So, a straightforward case does not require any investigation, we will directly go into treatment. Suppose we have a doubt or it is a recurrent infection of the lateral pharyngeal band, and if you happen to do a blood test, that may show or it may suggest that there is a bacterial infection or a viral infection. And there is one more inflammatory marker, there is C-reactive protein that may be elevated in a case of infection. This lateral pharyngeal band infection, most commonly it may be due to a streptococcal infection. In that case, we have a specific test for that and the report comes very fast within 20 minutes. That is why it is called a rapid test, rapid strep test. And likewise, in case of recurrent infection, we would like to take a throat swab from that lateral pharyngeal band, so that we come to know which bacteria is involved and which antibiotic can be given against that. So, coming to investigations, to start with, we will give a painkiller and throat gargle, and suppose the infection episode does not subside within 3 days and there is persistent fever and blood investigation shows a bacterial infection, we would like to give a course of antibiotic. So, this is how we manage acute episode. In case of recurrent episode, we would like to cauterize both the lateral pharyngeal bands, and cauterization will be with chemical cautery, that is silver nitrate cautery. So, that will take care of the lateral pharyngeal band, and so that we can prevent recurrent infection of the lateral pharyngeal band. So, that is how, this is what lateral pharyngeal band means, and that is how we manage, this is how we manage infection of lateral pharyngeal bands. Thank you so much.